Hello everyone, my name is Surina and I'm a core surgical trainee working in the UK, and I managed to secure my top choice job location last year with some very careful planning because yes, you can work hard, but I definitely believe in working smart always. And in this video, I'll be sharing my top tips on how to do just that when it comes to the core surgical training program application process. I've actually applied for the CST program twice. The first time round, I got a job, but not in a location that I wanted to work in at all. And the second time round, I was laser focused on getting my top choice location only because A, I really wanted to work there. I'd heard good things about surgical training, and B, because my partner had already got a job in that location and I wanted to make sure that we could definitely live together and commute to both of our jobs from one place only. So I really wanted to get that same location too. And that leads me on to my first top tip: try and then try again. You might be watching this in your F2 year and planning to take a year out of training like many F2s do, or you might have an interest in surgery but not feel like you've been intentionally building your portfolio and so don't feel particularly ready to apply. My top advice would be to just apply anyway. The first time I applied, I already had a job lined up for me in Australia and I didn't really have any intention of taking a training job in the UK. But my God, was I so grateful that I had applied and gone through the application process once already by the time I came round to applying for real a couple of years later. Just getting into the mindset of applying, even when you don't feel like you're ready, is so incredibly valuable because it forces you to look up what the portfolio and the application process involves and what you need to be doing for the process. And it really helps you do all your portfolio admin of getting letters and certificates from random places that you need to find them from, so they're all ready for your application. I did most of that work the first time round, which made the second time round of applying a lot smoother just because I'd got most of my admin bits sorted. Plus, if you're lucky enough to then get an interview, then it's quite literally just a free practice run to see what the process feels like, see what the interview is like, to help you come back better the next time when you're actually ready. You might be thinking, well, if I don't feel ready and then I get a job, then that introduces a lot of confusion about what choices to make and what to do next, because training jobs are not easy to come by and it is quite hard to turn them down. Well, to that I say it's always better to throw open more doors rather than not even knocking on some. Plus, having choices also forces you to consider what your values are and actually make decisions that are in line with those values rather than just letting life happen to you. For me, going through the process of applying the first time round was not only such useful practice, but the process of getting a job and then not really being that excited about it was really telling about what I wanted from my life at that moment in time, and made me a lot more comfortable and at peace with the decision that I did make to not go into training that year. I wonder if I hadn't applied that first time round, would I always have been thinking, what if? And maybe I should have, but just going through it and having the opportunity to make those decisions made me feel a lot more comfortable about those decisions in the long run as well. Tip number 2, find a map. It sounds incredibly obvious, but you can't get to where you're going without having a map telling you how to get there. The number of juniors who tell me that they are interested in surgical training, but when I ask them what the requirements are this year or what they need to do next, most of them actually haven't looked up any of the process yet. The process and requirements can be quite specific and they are changing all the time, so it's really important you keep an eye on them so you know what you need to do and what timeline you need to do it in. I had a quick look to see what the process was for this year just gone, because although the individual components might change a little bit here and there, the rough timeline stays quite similar from year to year. So this last year the applications opened in October, they then closed a month later in November. In January, you were able to sit the MSRA exam. In February, you had to upload your portfolio evidence. Later on in February, you had the interviews beginning, and then by March, the first round of offers were made. As you can see from this timeline, this whole process boils down to 3 main elements: the portfolio, the MSRA exam, and the interview. The portfolio makes up 30% of your final score, the MSRA exam 10%, and the interview 60%. How you score in these sections determines how you rank, and how you rank determines A, if you get a job offer, and B, which job in your job ranking order you get. I know it's a lot to think about, but don't worry, in the rest of this video, I'm going to go through each of these 3 components and share with you my top tip in each section. Tip number 3, to power up your portfolio. The portfolio is the step that you can start preparing for first, which is just as well because it definitely takes the most time to prepare. Also, unlike the MSRA exam and the interview, the portfolio tends to act as the key differentiator between the candidates. Whereas the scores in the MSRA and interview tend to be quite close together, the spread tends to be a lot wider in the portfolio, so this is where you can really try and stand out as a candidate. What's more, the portfolio is the part of the process that you have the most control over. The requirements are stated quite early and quite explicitly, and there is a lot of low-hanging fruit, i.e., easy things that you can do quickly and efficiently to really rack up points quickly. Trust me when I say it is very possible to rack up a lot of points in a matter of weeks. I wouldn't recommend it, but it is possible. I'm not going to go into the portfolio in great depth here because I've actually already done an entire video going through each of the key sections in the portfolio, which tend to remain same, although the contents of those sections changes slightly every year. But I really recommend checking out that video for more portfolio specific tips. My top tip for the purpose of this video will be to go far together. Find some colleagues or friends who are also applying for CST or some very supportive seniors, and just half the workload and double the output between all of you. For example, you get maximum points in the teaching section if you teach a course with 4 sessions in it. So if you find 3 friends, then you can all teach 1 session each, which is considerably less work than one of you trying to do a course of 4 sessions by yourself. And in this way, all 4 of you will maximize your points in this section. Similarly, if you find a colleague to do some research with, one of you can put your audit data together for a local oral presentation, whilst one of you puts your research project data into a poster presentation. And if both of you have been involved in the data collection of these projects, then you can both claim for these presentations as well, because both your names will be on both projects, even though you split the workload of who actually did the presenting. But do check out my portfolio video for even more tips on the specific sections. Tip number 4 for mastering the MSRA. The Multi-Speciality Recruitment Assessment, or MSRA for short, is a small but mighty beast. Although it is the most irritating recent addition to the CST application process, its importance should not be underestimated. As you may remember, the MSRA makes up only 10% of your final score. However, crucially, it is the only thing that determines whether you get shortlisted for an interview or not. So, in 2023, that means from 2,500 candidates who applied for CST, only the top 1,200 scoring candidates in the MSRA progressed further to getting an interview. Only these 1,200 shortlisted candidates had their portfolio scores evaluated, and together with their interview scores, only the top 600 scoring candidates were offered a job. So yes, this exam is annoying, but it's a crucial part of being shortlisted for interview, so it's really worthwhile taking it seriously. The MSRA is an online computer-based exam that you have to go to one of the centres where you do your driving tests to go sit it. That means it can be sat from around the world, which is really useful if you are taking a year out to go travelling or working abroad. There are 2 papers. Paper 1 is the Professional Dilemmas paper, which is made up of 50 questions and you have 95 minutes to answer them. They are basically situational judgment scenario questions where you are given a scenario and you pick the 3 most appropriate responses, or rank 5 responses in the order of how appropriate they are. Paper 2 is the clinical problem solving paper, which is made up of 97 questions and you have 75 minutes to answer these. These are multiple choice questions based on clinical knowledge of multiple different specialities such as pediatrics and medicine and obstetrics and gynecology. Very relevant for surgery, I know. My top tip for preparing for this section is less is more. This exam is a purely emotionless hurdle that you just have to cross in order to be able to shortlist for interview. It has no real bearing on your professional development. It does not really add to the knowledge base that you need as a surgical trainee. So you just need to drill down and do practice question after practice question without really trying to read around topics or build much of a deeper understanding for any of the topics it covers. You will find that there are numerous question banks and courses all claiming to help you pass the MSRA, and it's really easy to get absolutely buried in all of them, trying to figure out which one's best, and then not making really that much progress. I would say just pick one, maybe two, but do them to death. Paper 1 with the professional dilemmas is more about exam technique, and paper 2 with the clinical questions is more about your actual knowledge. And to get better at both of these types of questions, you just need to be doing multiple questions again and again, so you can get your eyes on all the types of questions that come up and all the kind of knowledge that is tested. The question bank I went with was Past Medicine, and this is not sponsored or an ad or anything, but I genuinely just found it really useful because not only did it have tons and tons of questions, which I couldn't even get to finish before the exam, but it really helpfully had a inbuilt textbook as well, which was especially useful for paper 2, the clinical knowledge paper, because the questions are heavily based on UK management guidelines, and if you're not familiar with them because you're not working in the UK, or in my case I'd been away for a couple of years and quite a lot of things had changed in that time, the guidelines are all very accessible in that textbook, so you can learn as you go along and you don't need to be looking in lots of different resources to try and find the most up-to-date knowledge. It's all in one resource, which made practicing for the MSRA really, really efficient because I could just keep drilling questions, keep learning from the textbook, and not have to waste time on doing any extra reading. A quick note on the scoring system of the MSRA, because it is a little bit confusing. Your score is basically determined on how well everyone else in your cohort does, with the score of 250 given for the average score that year. If you're wondering what made the cut for CST interviews, here are my scores for the 2 papers as well as my overall score as well. There's no official information on any cut-off scores for interview, but reading around and anecdotally, it looks like a score of around 500 to 520 is what you're looking at in order to be shortlisted for interview. So just average or just above average would be enough. And then if you've made it through all of that, it is time for the interview. Tip number 5 is to immerse yourself in the interview because this is where the money is at. The interview is worth 60% of your final score, so if you're trying to get your top choice location, then this is where your efforts will really count. Something I did the second time round, which I definitely didn't do the first time round, is to treat the interview like an exam and give it the time and energy and respect that it deserves. As you can see from the timeline, the gap between when you do your MSRA in January to when you do your interview in February-March time is not very big. And so my advice would be to get cracking on with interview prep as soon as the MSRA exam is out of the way. This is because interview offers go out only a couple of weeks before your actual interview date, by which time it's really too late to begin your preparation. Hence, I would start preparing as if you're going to get an offer as early as you can after the MSRA exam is done. The interviews are all online and have been following a pretty standardized structure for several years. They are 20 minutes long and divided into a 10-minute section for management and leadership and 10-minute section for clinical scenarios. In the 10-minute management and leadership section, you have 5 minutes for presenting a pre-prepared management and leadership question where you answer a management and leadership question that was emailed to you a couple of weeks before the interview. This is followed by 2 minutes of questions about it from the interview panel. Next, you will have a 5-minute section answering a ethical or professional dilemma scenario. This will usually touch on topics such as capacity or consent or confidentiality, and it's a lot more about seeing how you react on the spot. The clinical section is made up of 2 5-minute clinical scenarios. Usually one is about an acutely unwell surgical patient, while one is about a trauma situation, And you basically talk through how you would manage a patient in this situation as a core surgical trainee. Now, if you do a quick search online, you will find tons of information about how to structure your answers for each of these sections. But my top tip here would be to practice and practice and practice until you are blue in the face, reciting your structures and common phrases that the interviewers are looking for so you know them inside out. Because when you're doing your actual interview, you've only got one shot and it's a lot of pressure, and so you need to be relying on lots of practice that has helped you work the relevant muscles in your brain so that you can rely on muscle memory when you're under pressure and come across really organized and really calm. This means practicing by yourself. You will have to get over the cringe of talking to yourself in a mirror or something. Practicing with friends, this is where your other friends and colleagues applying for CST will come in really useful. Practice with seniors, especially those who have gone through the process recently and can give you a bit more pressure than maybe your friends might be able to give you. So just find anyone and everyone to practice on. This was the main area that I differed in so much between my first attempt and my second attempt at applying. The second time round, I was practicing day in and day out between the MSRA and interview. Having said that, I was also traveling all over Australia as well at the same time. But one resource that really helped me in this bit was the MediBuddy interview question bank, which again, not sponsored, not an ad, but just a really fantastic resource, which is what my partner, who was also applying for CST, and I were doing back and forth on car journeys, train journeys, plane journeys, because although we were traveling so much, it was important to keep practicing, and that app made it really, really easy because it had ready-made scenarios, ready-made answers, and lots of common things that have come up a lot in previous interviews. So working through all of that proved to be really, really useful for interview day. In terms of resources, over the years, I've collected lots of practice scenarios from various free courses and things that I've done, which I will put into a PDF and link down below. On that note, do keep a lookout for these free courses. They're often advertised on Twitter or Facebook pages of various hospital deaneries, and often they are free of charge, and often they are with CT1s and CT2s who have really recently gone through the process. So the feedback they can give you is really useful. Other resources for the clinical scenario specifically, I would suggest using the CCRISP textbook for managing acutely unwell patients and the ATLS Advanced Trauma Life Support Handbook for going through your common trauma scenarios, how to do your primary and secondary surveys. Keep it simple, don't go crazy with resources, but I would find 2 or 3 key ones to go quite deep into to make sure you're really, really well prepared for this interview to maximize your chances of getting the job you want. And one bonus tip before we finish is to just breathe. Applying for the next stage of training in a medical career is an extremely stressful thing to go through. I know several people, me included, who didn't get jobs that they wanted, didn't get locations that they wanted, and it's difficult, but I always say try and look at what an outcome adds or gives to your life rather than what it takes away. Almost everyone I know who ended up taking years out or working somewhere they weren't too sure about or doing something that they weren't expecting to do that year have all come away having gained something from that experience. I know we are constantly trying to make our lives mold around this picky and difficult at times career, but this career path is long and it's definitely not going anywhere. So make decisions that work well with your life. Try and fit your career around your life sometimes as well, and not just the other way around. Take each step at your own pace and try not to attach all of your self-worth and self-identity to its job, because although it is an incredible career, which we're really lucky to be doing, it is also just a job. And it's a career path in which there are loads of options, even if they aren't immediately apparent or immediately laid out in a nice linear fashion as some training pathways are. So yeah, take it easy, enjoy it, try again if you have to, try something different. And the more I progress in this career, the more I realize that for everyone, it does work out one way or another. Thank you so much for watching. Please leave any questions in the comments below and I will try to answer them. And I hope to see you in the next video. Bye.